People wake up on a normal day and suddenly something happens that changes their lives completely.
Paediatric trauma call, 15 minutes.
A lot of really bad things happen to really good people, but you never think it's going to happen to you.
Stabbed 5 times, including chest, and he's got an arterial bleed from his leg.
High-speed RTC moped into wall.
Jesus Christ, what happened? You all right?
I love my wife.
Any reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Complete baloney amputation of her leg.
I can't breathe.
He looks frail, doesn't he? He looks like somebody who's going to break.
It's going to be one of those days.
A place where life,
Darling, what's for dinner?
love,
It's still as beautiful as ever.
We have a boy.
and loss
Don't make me cry.
unfold every single day.
And they said there's nothing they can do.
All the patients you're about to see were treated in just one 24-hour period.
You don't know how lucky I am to be talking to you right now.
We see situations where someone's life has just been turned upside down. People always try and remember what the last conversation was, or the last words that that person said to them. And I suppose it's so much nicer if the words that they remember are, "I love you."
Working the night shift, like any other shift, you don't know what's coming through the door. But I think when, you do get those quiet moments, it's really important to relax a bit. And have a laugh with your colleagues.
Just getting crunk.
The things I've seen during my career are things people never experience. And, as much of a privilege that is, it does get to you sometimes, and you do have to let your hair down and let loose once in a while.
Here we go, we'll take this arm out.
Emergency care nurse Simon is working in resus this week.
Here we go, good stuff. Oops, there we are, lovely. I'll stick that just there for now.
Most shifts, things just change really quickly.
Take these ones off.
And all of a sudden, you're faced with something that you don't know how to deal with.
Fuck off. You can fuck off, come on. Get off my fucking head. I'll squeeze your fucking head in a minute.
People with addictions, at the end of the day, they are a patient and they need help.
What we'll do is we're going to put this line in and then we can give you the morphine through the line.
I was a heroin addict, but at least I know it was chill me out.
Each patient's story is individual to them. People have, horrific upbringings, dealing with, stresses at work, relationship dissolutions. All these things, it's no wonder, really, that people do stumble and fall sometimes and find themselves living a life that perhaps wasn't their intention.
George's resus. Yeah. Left chest pain, yeah.
A 45-year-old woman is being brought to St George's suffering acute chest pains.
Final priority call, ETA 6 minutes.
Also working in resus tonight, is junior doctor Alina.
You have to be on the ball all the time, especially in a place like this one.
This is a 45-year-old female with chest pain. There we go.
At George's, because you know it's a trauma center, you know it's going to be dead serious. It's going to be an emergency.
Okay, this is Carol. She's 45 years old. She's had left-sided chest pain, radiating down her left arm, on and off, vomited a lot in the ambulance. But when we arrived, she was very pale, very clammy.
Okay.
Okay,
my name is Alina. I'm one of the doctors here. Can I take some blood first? You felt like a tightness more than a sharp pain?
It felt like something was literally, squeezing me.
Have you had this type of pain before?
Never. Never, but my dad come in over the weekend as well with a heart attack.
Carol's partner, Ken, dialed 999 after finding her collapsed at home.
I think I was at work, and when I came home, she was complaining of like a chest pain, and it got worse and worse and worse. She was saying she was getting like pains, like shooting from the back to the front and the front to the back. She said, I've not had a pain like this before. For her to say that, I knew there was something seriously wrong.
Right, let's try and do these bloods.
Do that as tight as you can.
The most important thing, especially for somebody who comes in resus with chest pain, is to take the bloods, send it to the lab to check for heart attack. Make a few fists for me.
Yeah, do you want to hit it? I don't want to break this one.
OK, don't hate me if this doesn't work.
No. I've been clean for 10 years now, anyway.
There's nothing there.
No?
In the past, she was a heroin user. It's the dirtiest drug you can imagine, and I don't really like it. Don't like even thinking about it. It's horrible. Horrible spell in her life, in my opinion.
You might get one by my knee, it'd be better.
No.
I did used to abuse myself years ago.
Well, maybe this one. Yeah, hold on. She was very open about it. She was saying, I'm sorry that you can't find the veins, essentially, because I've damaged them.
Should you keep it, mate?
Sorry. No, this is blown. Her ECGs were not typical, so I was concerned. All emergencies can always turn for the worse.
I've got that pain coming in my back again.
She could have had a heart attack. Time was of the essence.
But do you know what, I just think that's a silly question. Does labour hurt? Well, why don't you push a baby? Why don't you push something this big out of something that big and then tell me if it hurts? Ridiculous.
No, I think it depends on your pain threshold, though.
No, it's got nothing to do. It doesn't matter. You could have the biggest pain threshold ever, and I guarantee you, when that baby's head comes out your nunny, it's going to hurt, mate.
Doctors are worried that Carol is at risk of a heart attack. They need to check her blood for signs of heart damage.
We've got some blood there.
Good. Wow. Oh, I feel better.
So what they said?
Every ECG is abnormal.
Abnormal?
They think there might be a blood clot gone round here. It's pretty serious, actually.
Over 20 years ago, we just used to drink in the same bar, and Carol and I just became good friends, very good friends. And then, for some reason, we went in separate directions. A couple of years ago, I was sitting in a pub, and she was in with some other people. She came up behind me and pulled the top of my head back and gave me a kiss on the top of the head, because I hadn't seen her in such a long time. And we was talking, and I said, do you still like motorbikes? She said, yeah, of course I do, naturally. So I invited her out, and that's what started all the trouble then. So that's when it all began. She's a very independent woman. She knows her own mind. She's a person that likes living life to the full as much as you possibly can anyway. I love her. That's it, bottom line.
I felt so scared earlier, I really was so scared. I don't mind admitting that. Again, I thought I was going to die. I really did.
I've lost many people, too many people, I'm afraid. Lost my sister at the age of 51 to cancer. I lost my father to a heart attack when I was 21. I wasn't sure I was going to get through life without him. I miss him terribly even now.
Yeah, I look rough, don't I?
Yeah, you don't look right. Soon you're looking better, let's put it that way.
Can't look gorgeous every day, love, can I?
No, of course not. No. I'm looking a bit rough around the edges as well at the moment, I think. Without Carol, it would be extremely hard. Extremely hard. First impressions might not always be actually the way she is in life. She's quite a caring, considerate, kind person. In the January of the year that I met her, she was still recovering from a serious operation to remove 2 cancerous growths. It is her inner strength that's seen her through everything, because without it, I don't think she would have been able to carry on.
Okay.
Yeah.
So it might be something to do with your heart, because the test that we do for the heart has come back high. Cardiologist is going to come and see you.
I thought it was something to do with that because the pain was unbearable.
So we're giving you some drugs now, a blood thinner, if that's a clot, to do something about it. And they're going to come and see, but I don't want you to worry.
Okay.
Okay?
Yeah.
I think it's a great help to the patients to have somebody there that can support them. Humans are naturally predisposed to depend on other people. Although it's great to be independent and have your own life, be able to deal with all these things by yourself, it is important to have somebody to turn to and support you, to spot those stressors in you.
I really don't feel well.
We're in the best place for it.
It's cute at the door.
Yeah, I know. We got him right in time, didn't we? A&E, what a place to work.
Oh, I'd love it.
Would you? Oh,
the dramas that must go on here.
yeah. This geezer's in a bad way. Look, coming through the door here. She's had to escort him outside for the fact. I don't know, but his face looks bad.
What's he done?
Look at the size of it. It's like out there. Do you ever finish that?
Dinner lady Colette has come to A&E with her boss Stacey, having had an accident at work.
OK, take a seat.
Thank you.
In fact, you were chopping some food today.
I was.
Right. OK, so you've got is it a laceration to which finger?
My little finger.
Little finger. What were you chopping?
An aubergine.
All right.
It's not funny.
As you do.
Do you smoke?
Yes.
How many do you smoke a day?
About 15. Quite a lot.
Alcohol?
Yep.
OK, so we've got a survey on this. How often do you drink alcohol? Never once a month or less, 2 to 4 times a month, 2 to 3 times a week, or more than 4 times a week?
2 to 4 times a month.
OK, great. On those drinking days, how much alcohol do you usually drink?
Bottle of wine.
That gives you 5 out of 5. Perfect. Is that good?
I hope so. Yeah, it's funny because you just said yesterday, watch that knife.
Who's
No, he's the head chef.
Oh, yeah.
He sharpened the knife for me.
Oh. This is the second time with Colette.
It is the second
We made it
time.
to the walking clinic last time.
It was a little one
this
last
time. We've made it to A&E.
more serious, this one,
Okay.
I think.
Well, let me look at it first. Yeah. Put your finger up here. Thank you. Right, lovely. Calm, calm, calm.
Quite a bit of blood.
Okay, now let's just look.
I'm no nurse, but it don't look great. Oh, you've got to take those glasses off. Oh, you look ridiculous.
Okay.
25-year-old Lucy has been brought to A&E by her mum Tracy, suffering with a severe headache.
You'd like something out of Duran Duran.
I have intracranial hypertension, which basically summed up means that I have excess spinal fluid in my head, on my optic nerves, in my brain and my skull. If I had to liken it to anything, it felt like somebody had put a nail in my head and was just hammering it in further and further and further.
It really hurts.
I think they need to admit you and do a lumbar. Well, at the end of the day, that's what they need to do to get rid of the pressure, isn't it?
I had a lumbar puncture where they insert a hollow needle into your spine and they can pull off the spinal fluid to lower the pressure.
Hi, I'm Manny. I'm one of the doctors. Nice to meet you.
Hello, nice to meet you.
You're right. Hello. Hi, you are her?
Mum.
Nice to meet you.
Hello.
All right. How are you getting on?
Not too great.
Just going to shine a light in your eyes, all right? Just look straight ahead. Okay, is there any part of my face that you can't see any part of my face? Anything missing?
Yeah, there's like a grey patch.
Okay.
I had complete sort of tunnel vision at one point. I lost sight in one eye. I mean, left undiagnosed, I would have gone blind.
Well, look at my finger. How many can you see?
One.
Just follow it across.
You're thinking then that obviously this is quite a serious situation now because, you know, what has she got? And for her as well, you know, it's like a massive step backwards when you feel that you're not going to be able to earn your own money and you know, she's a single mum and with Ava and I think she's amazing. I think what she copes with in life, you know.
Cover up this eye. Okay, is there any part of my face that you can't see any part of my face?
Ava is, well, she was our little surprise. I was 24 weeks pregnant when I found out. So, yeah, I was quite far gone.
Sorry, is it just generally sore?
Yeah. So it'd gone from a stick saying I was pregnant, and then within a week, I'd had a scan picture, and she had a face, she had a nose, she had hands, she had fingers.
Yeah, so neurologically everything is intact. There's nothing abnormal there.
My life's completely different now. Everything I do is for her.
We just need to get you more comfortable until they can make a decision to say if they want to do another lumbar puncture or not.
I'm just worried that if it's at a dangerous level, you know, in my eye, because I've got these blind spots and stuff in my eye.
I appreciate that, which is why we need to do something about it.
I can't do anything with this pressure in my head.
The whole essence of motherhood is when your child needs you and you're there, you can make sure everything's all right and safe and you reassure them, you know, and when there's something that you can't do, I mean, obviously you feel redundant.
Any questions? I'll be back in a bit.
Hi. So this is an echo scan, so it looks at the heart and how it's functioning.
Right. Oh, like a pregnancy scan sort of thing?
Yeah, kind of like a pregnancy scan, but for the heart.
Turn now, yeah?
Yeah. So you're sort of facing the wall.
A cardiac specialist is scanning Carol's heart for signs of damage.
So we're just looking at the heart function, looking at the valves, how they're working, and also the walls of the heart and how they're moving. No, actually, I think the apex isn't moving properly. I suspect that this is actually ACS.
What does that mean?
Well, I think that this is probably a heart attack that's happened along the way over the last couple of days.
It certainly felt like something.
Yeah, I mean, the top of the heart's not really contracting in the way it should, and that would fit with a stunned heart from a narrowing in one of the arteries that runs around the front of the heart.
Is that through the years of abuse?
How have you been abusing?
Well, 10 years I've been clean now.
10 years you've been clean?
Mm-hmm.
When you say clean, what were you not clean from before?
Oh, heroin.
Heroin. Injected?
Yeah.
Certainly those things don't help.
Sure enough. Obviously, the drugs is my biggest ever regret. I was on heroin for a good 10 years itself, but before that it was milder drugs like speed, cannabis, and then onto the heroin, yeah. I don't really know how it started. Just by hanging out with the wrong kind of people, I think. I just wanted to fit in somewhere. It was like I was always looking for somewhere to fit in, and it never did happen. I just feel really bruised.
Sure.
Like someone's kicked me from inside.
Yeah. OK, that's probably enough. We'll organise a test called the coronary angiogram, where we put a tube in through one of the arteries of the heart up to the top of the heart.
I'll be asleep though, won't I?
No, you're awake. It's done under local anaesthetic. So you'll be in, I'm afraid, for a couple of days, and we'll try and get you to our ward.
OK.
All right.
Lovely. Grown up, me and my brother always thought we got in the way of our mother. We got put into care when I was 11, he was 14. Pretty rough start.
Do you mind me asking why you were put into care?
I don't really know. Myself and my brother. We wanted answers. We had no answers. You have to do 6 weeks there before you're allowed home for a weekend. So after the 6 weeks, they booked me a National Express coach home, and I knocked on the door, and there was no people living in our family home. My mother had moved. We didn't know where she was. When you're 11 years old, you're very young and immature, and you do wonder if it's something you've done, because you've always been told that you're naughty, you're a bad girl, and it stays with you. I think I just didn't like myself so much that I didn't care what I took in the end.
Carol is being taken to the cardiac unit, where specialists will attempt to unblock her arteries.
It's easy to say, you know, in hindsight, yes, Carol shouldn't have used drugs. But then all of us shouldn't have done all sorts of things. I used to smoke. Everybody needs a release at some point. Some people choose that. I wish they wouldn't do it. But then different people deal with different things.
What do you want now? You want cake? I thought you'd want the cake. I'm going to eat the cake.
I'm going to eat
I'm going to eat the cake.
No, I'm going to.
Right. Who's the oldest?
What?
Who's the oldest?
Me.
Right. Who's the prettiest?
Me.
Oh, I'm not going to win this, am I?
I'm joking.
I know.
Hello there. I am Shabana, one of
Hiya.
Maria's colleagues.
Yes, very good colleague. So this lady was cutting some aubergines. So basically, she cut it with a sharp knife, not serrated. I want you to lie down with your hand out here, further nearest to me. No, but head down. Lie down. Now the worst bit actually is going to be the injection.
A bit like a is it numbing like you'd have at the dentist sort of thing?
That's right. So it'll start in the bottom of your finger and work its way up.
Yuck. My hands are sweating already.
You right?
How's that?
Do you know what? I'm just a bit of a wimp with the pain.
You're not. Let me tell you, you're not. Not one bit. You've had a baby, Claire.
I know I have, and that's why I shouldn't be so stupid.
It's all right now, yeah? Good. So it's quite
Oh,
yeah,
yeah, that's much number. Oh, sorry, Stacey, I'm squeezing your fingers.
No, you're all right.
I just thought I was still grabbing hold of you.
I know how Jay felt there when I was in labour.
The one last one.
Okay.
And
How many was that? 3?
That
That's
would
3,
make
yeah.
it 3.
3, there you go.
Oh my God, it feels like about 8. Are we done, girls?
You're done.
You're right. Do you want a tissue?
No, I'm right. Oh, don't be silly, that's fine.
You're being very,
Oh, it's been a long day.
I know,
It's
I'm
been,
like a little girl,
It's been, yeah, it's been a long day as well, so...
Amen. Oh, thank you.
Amen as well. Oh. Right, well done. Now, I'm just going to need to give you a sling.
St George's Emergency Department.
Philip, a 53-year-old man, is being rushed to St George's after a suspected stroke.
Yeah. Thank you very much. Bye.
Middle priority, 8 minutes.
Priority
Hi, can I put a thrombolysis call to resus, please?
Philip's friend Claudia has travelled to St George's to be with him.
This is the reg. Hello. He'll be speaking to you mostly. We'll start off by doing a blood test.
Neurological. Just talk me through what's been happening. Does they?
Right. When I woke up, I couldn't walk at all on my right leg. So I was walking, with a limp, just about able to get out and about. I noticed perhaps I was sort of drifting a bit to my right arm. Started to feel a bit weak. Just lost some motor.
What's your job, sir?
I was a psychiatrist. Now, retired, of course.
He was clearly a medic. I mean, you sort of picked up on that very early through the language he used and particularly how switched on he was about what was going on and the situation, the way he described it.
Besides the problems that you've mentioned already, any other past medical problems at all?
Lung cancer.
Yeah.
Diagnosed. Died in November 2012.
Yeah.
One of the problems with lung cancer and many types of cancers is they do have a propensity to spread to other parts of the body, and the brain is a key target for some of these.
Hi, Phil. Sorry, I want to look after you. I want to see how you are. What's happening?
Well, I had a seizure.
So what does that mean? I don't understand.
Well, the brain activity goes haywire.
And then?
Well, then it transfers to whatever part of the brain.
So you're shaking?
Yes. My leg. And it just went into complete spasm.
Your leg went into spasm?
Yes, lasted about 2-3 minutes.
He's very gentle, very friendly, like a real gentleman. Also very smart and bright, Very good at listening. When I first met him, I had this feeling already that I'd known him for forever, at least 20 years or whatever. It was very weird. There was this immediate connection between us. I mean, he's definitely been my best friend, If over a long time, possibly the person who's been closest to me in my life.
Can you get reception here?
Why, do you want me to call your mother?
Yes.
Here.
Hello. Hi there. Back in hospital.
He'd lost his voice because of the cancer.
I had a seizure. I had a seizure.
From a very, very early age, he was quiet, very, very quiet indeed, and rather go in the background rather than be in the forefront. He did think of others before himself, always, always. He was exceptionally kind.
Okay, Mum.
I must admit I regret sending him away to school, but hindsight is wonderful. I should have kept him at home because he was gentle.
Okay, then.
And very gentle with his younger brother.
Word of mine.
Okay.
Thank you.
So you think it was some sort of stroke?
My leg was paralysed and still mostly is.
Did they say, will it come back? Is it just temporary then, the leg?
They think so, yes.
Okay. But at least you should be able to walk again, you think, on crutches or something.
Let's hope so.
Doctors need an urgent scan of Philip's brain to discover the cause of his seizure.
How am I getting there?
We're going to wheel you there now.
In a chair or on the bed?
No, in the bed.
Okay, thank you.
I think the thing that sort of struck me about Philip is he was very much the sort of person you could see yourself being in his shoes, as it were. I'm certain that in himself, with his sort of background history and pre-existing diagnosis, he probably had suspicions about what the other possible diagnoses could have been. He did sort of ask, could it be related to the cancer? And there is, clearly one answer to that. Yes, it could be related.
How are you feeling?
Everything hurts. So if I put my cardigan on to get dressed in the morning, everything.
What about eating? Can she eat at all, or?
I'm quite hungry.
Okay, I would just say hold off, and then one of the doctors will be in.
Wait for doctors.
So yeah, I just hold off, just in case you start vomiting again.
Lovely, thank you.
Lucy is waiting while doctors determine how best to remove the fluid in her brain.
I don't need a sandwich.
Wait and see the doctor first, see what he decides to do. What do you think about your gut? He might say nil by mouth.
No, he will not.
Well, I don't know what he's going to do yet.
Nil by mouth. I'll say, listen, I'm going to have a tuna mayo before you do anything. Honestly, I'll level with you.
Yeah.
So I've always, I enjoy food.
No idea.
But then also there have been times where I've definitely been a comfort eater. I'm down there, but I can't go down there like this.
No, okay. It's a vending machine.
Chinese food. Biggest weakness.
You go back in your thingy, take that.
Crisps or chocolate and just get a selection. It's convenience. Obviously, when you've had a baby, all mums will know that it's just, what can I have now on the go to keep me going? Because I'm on about 2 hours sleep and I'm exhausted and I need something now. It's stressful when you think, a glass of wine and, a bar of chocolate. But it's just habits that you don't watch and it starts to slide. What did you?
No, it's fine. Just have that.
What did you get? Share a Kit Kat with me.
No, I don't want to carry on. That's the best I could do. There's not a lot of choice there. It's not...
Lucy?
He's coming.
Hiya. So I've just spoken to the neurologist, who basically has advised a couple of things now. He says the main indication to do anything as an emergency, which would be a repeat lumbar puncture, you might eventually need to have a shunt fitted, which is a permanent drain from either the spine into the belly or from the brain into the belly, which drains the CSF, the same thing we take off as a lumbar puncture. That's the kind of the end stage of it, if we can't get it better any other way. You'll probably come in under the care of the medical team and have anything done tomorrow.
Okay.
All right.
So I can stay here overnight?
Yeah. All right, guys?
Yeah. My mum's more calm. I'm definitely the panicker out of the two of us. And I take her advice over anybody else's because she's the most honest person I know and the most loyal.
We're going to go on to the ward now. Are you all right to sit in the chair?
I just think, I don't know how she did it with 4 of us. As it is, I don't stop. With 1, she raised us all on her own for the length of time that she did. And even now, she's still looking after us.
Sweet.
I don't know what I'd do without her because she's such a massive, massive part of all of our lives, so.
Not a very good driver. You should have let your mum push the chair. Thanks, man.
Nurse Simon is about to start another night shift.
I went into my nurse training because of my mum. She is a nurse as well. My dad's a pharmacist, so when we were really young, Dad would be on call on nights, Mum would be working nights, and so if Dad got called into the hospital, we'd be running around the hospital in our pyjamas up until we were about 15, so although I think I'd managed to put my clothes on by the time I was 15.
You stay nice and still, we're going to move you across now on this special mattress.
Ready, brace, slide.
Did you feel loved when you were growing up?
Yeah, like, immensely. Like, that's what our family is about, really. It's loving and supporting each other. I think had I not had them guiding me the way they did, then I wouldn't be where I am now, I don't think.
Okay, Carol, there's a blockage in one of the arteries of your heart, okay? We're going to try and unblock that now, okay? Cranial, please.
How did you stop using heroin?
One day I just went, this has got to stop, it's enough, because I'm ill.
You're going to feel a sharp scratch in the groin. Keep nice and still. I'm sorry about this.
It's very hard, very, very hard. But perseverance, basically. We didn't know, obviously, myself and my brother, where my mum had gone. I used to drive everywhere. We used to pick a different town every day. We'd jump in the car, go and look on the electoral in every town. It took us 10 years. And when I phoned up, she didn't say, oh, hello, Carol, or anything. She just said, my husband's died. So I hung back up. And that was that. I wouldn't have thought I would be here even this long down the line. Now I have a life and I love it. And I don't want to lose it, I want to be part of it. I'm a very proud mum, 2 lovely boys. They love their mum as well. Just wanted to belong somewhere, which I've found now. 20 years down the line, we can again. And we're very happy.
All right, well done. I'll see you later on, okay?
Carol will be taken to a specialist cardiac ward where her heart will be closely monitored.
Family's very important to me. It's not till you haven't got it that you realise what you have got when you've got it.
Philip is back in resus, having been given the results of the CT scan of his brain.
It's shown a lesion, which doesn't really look like stroke.
A lesion where?
In my brain, round about here.
Oh my God.
So it's quite likely to be cancer in the brain, metastasized.
And that causes the problem with the limping leg then, or what? Because I thought it would be in the spine or something.
Yes.
But it's not in the spine, it's in the brain.
Yes. So this is bad news for me.
No, it is, it is.
I try to be in the same mind frame as him, you know, just to say, okay, this is how it is now, we need to get on with it, you know. I try to not judge it or think about it, or, you know, and at that point I just thought, yeah, and it was possible for me to be like this because he was like that, so in a way he gave me strength.
He just accepted it, as simple as that. Never complained.
You wouldn't be good enough to fish out my nicotine chewing gum.
Yeah, I could.
They're in my trousers.
Okay, wait.
Right-hand pocket.
I never liked to intrude into his life because he was so quiet. I felt I was intrusive and I didn't like that. But since his illness, we've been very close. We were close before, but he was very self-contained. Maybe not very talkative, but a very, very good listener. And I suppose that's what you need in psychiatry, for someone to pour out their hearts to you. He worked with drug dependency and with not just alcoholism, but heroin and other hard drugs. He told me not so very long ago that he treated them all as gentlemen.
Hello there again. It's Chris, the neurology reg. Hi there. So I just thought I'd let you know what the plan is now. Good. What we will do is we'll admit you under the oncology team. I see. Yeah? I'm going to put you on an anti-epileptic called Keppra. Yes. Yeah. And they will see you in the morning. Okay. Okay? All right. Take care. Thank you.
So, Freddie, we're going to the ward now. Can't really give you. Thanks, yeah, see you. I'll see you tomorrow. Yeah. Good night, yeah.
Philip was brought to St George's with a suspected stroke. Scans have revealed his lung cancer has now spread to his brain.
He had pretty much no negative feelings around, you know. I mean, what I would say is ugly feelings, you know. Anything which is pessimistic, ungrateful, negative, angry, all of that. I don't think he had any of this, you know, in his mind, you know. So that's what I would call a beautiful mind.
Philip will be taken to the oncology ward, where doctors will further assess his brain tumour.
He said not to worry, that he was okay. But I came up anyway and went to see him in St George's, by which time he was much better, his movements were better.
It was difficult and you know, I think he understood the consequences of this.
What would you say to a younger you?
Don't abuse your body. You're going to need your veins when you're older. Take the better path, not the rotten path. There's life out there for everyone. You just got to find it, work at it and keep it.
Since I came out of hospital, I've lost just over 1.5 stone. And touch wood, I've had no relapses and I'm almost completely symptom-free.
He had a tremendous week. He'd been out with his work colleagues out to a restaurant on Tuesday. Claudia came to watch football with him on the Saturday. They had dinner together. And I think he opened a bottle of wine or champagne or something to celebrate that he'd been home for 17 days, the longest he'd been out of hospital for a long time.
You know, I showed him, like, or told him pretty much, because he couldn't see it, about the bubbles rising in the champagne glass. And, okay, he couldn't see it, but he could, you know, imagine it, you know. And then we had the champagne of the strawberries, and he seemed fine, yeah. But then all of a sudden, yeah, I mean, he.
I didn't expect him to die so quickly. It was a complete shock. And he shouldn't have been, but it still was. And he told Claudia, I think, that I'm dying, Claudia. So he knew he was dying. It was his one desire to die quickly, and he had his wish. And not to die alone.
It was very important for me that I am there when he dies. And so I'm very grateful that I was there, that I could see that he didn't suffer. I was very happy that he wasn't alone, you know.
Claudia was with him. And for that, I should be forever grateful. I would have been haunted had he died on his own.